I get the pleasure of talking to you today about ozone therapy and its use for acute and chronic infections. First of all, what is ozone therapy? Well, what is ozone? Ozone is a gas that's found naturally in the air, but where it is found in the air actually determines whether it has a good effect on life or a bad effect. So it's found naturally near oceans. It's created when lightning strikes and thunderstorms, and it is very highly reactive and short-lived. But it's also what gives us that little sweet smell after the rain. Higher up in the atmosphere, ozone provides a protective layer from the sun's rays, and it also keeps the heat in after the day has heated from the sun, so that when we're not facing the sun, we're not freezing. The time that ozone is bad is when it is mixed with the chemicals that come from our cars, our plants, and then it is the main component of smog. History of ozone therapy, well, it was discovered in 1840 by Professor Christian Schoenbrunn, and he tried to use it to stop meat from spoiling. And he also believed that it could be used to treat infectious diseases. Ironically, though, he was not able to treat his own anthrax with it. In 1851, a means of generating ozone was created. And actually, Tesla was the first one to patent a generator of ozone. 2 years later, by 1853, ozone was being used for medical purposes. And it was used to disinfect water because we knew it could kill bacteria, parasites, fungi, and viruses. It is still a major way of cleaning and disinfecting the water in over 3,000 cities, including many here in the United States. In 1871, there was the first published article on ozone, and it was used during surgery. During World War II, ozone was used to treat gangrene in soldiers in Germany. And by the 1940s, autohemotherapy was being used. And this is when administration of a small amount of blood is given ozone and put back in the patient's body. Ozone works by activating the immune system. It makes white blood cells more effective. There's a whole cascade of how that happens. I'm not going to get into that, but just know that it does. It enhances fibrolytic activity for the regeneration of tissue and cartilage. This is why it's so effective in joints. It activates red blood cell metabolism, which delivers more oxygen to the tissue. And it activates our own body to make more of its antioxidants, the ones that we were hearing about earlier. And it is highly antimicrobial against a wide variety of microbes, whether it's bacteria, viruses, parasites, and fungi, mainly by destroying their cell walls and making them inactive to replicate. Ozone is used many different ways in the medical field right now. It's being used topically by being added to added to olive oil, and it's used on burn patients. By exposing a small area of the skin to ozone, we can use a limb bag or a funnel for that. And then also through the pores, through steam and ozone in a sauna. Insufflation of ozone is done either rectally or vaginally, or else into a joint. Injections of ozone, orally we drink ozonated water, and that's proved to be very, very effective. Injections often used in dentistry, as well as muscle injections, subcutaneous tissue, and joints, like in prolozone. And then in autohemotherapy. And this is where blood is withdrawn from the patient, it is mixed with ozone, and then infused back into the bloodstream. It is not recommended that ozone be given directly into the venous system. This has been used in other countries, and it was used efficiently to treat Ebola, but we don't do that here in the United States. Indications for ozone therapy are arterial vascular problems, such as peripheral artery disease. It helps get more oxygen to the tissue. It helps with macular degeneration, arterial sclerosis of both the cerebral and coronary arteries. It literally helps to break down that plaque that surrounds the arteries. External ulcers and skin lesions, such as diabetic ulcers, ringworm, burns, acne rosacea, and a lot more. Inflammatory pain from acute and chronic causes, such as joint and tendon injuries, herniated discs, and arthritis. It is used as an adjuvant therapy in cancer. It is bacterial infections, both acute and chronic, viral infections, and this past winter we had a really bad influenza season, and we had patients that were better completely in 48 hours after an ozone treatment. And it's also antifungal. It will even treat systemic candidiasis. So where's the evidence? Well, it's really hard to find evidence on ozone in Lyme, so we're going to go with what we have. First, I found this very, very interesting article, which was a retrospective review of every article that they could find relating to ozone from 1986 to present. It was 1980 to 2017. And it reviewed how it affected the cardiovascular system, the gastrointestinal tract, genital urinary tract, central nervous system, head, neck, musculoskeletal, subcutaneous tissue, and peripheral vascular disease. And some of the most interesting findings were every single body system they tested it in had improvement. In diabetic foot ulcers, not only was there a significant decrease in the size of the wound, but there was a very significant decrease in the blood glucose levels. We don't even know how that happened. In patients with multiple sclerosis given ozone through autohemotherapy, they had an increase in oxygen levels in their brain, an increase in metabolism, decrease in the number of migraine headaches. This is important for a lot of Lyme patients. Sensorineural hearing loss in 45 patients showed significant improvement in hearing after ozone therapy compared to the placebo. Now, also part of this was in the vestibular cochlear syndrome, where people have a lot of nystagmus and that ringing in your ear that you can't get rid of. It was found that injections of ozone in the neck, in the area between the vertebrae, had a 65% improvement in tinnitus, and that ringing in your ear, 100% improvement in nystagmus, that feeling that, you know, the whole world's spinning. And then a 90% improvement in vertigo and 85% or 80% improvement in hearing loss. Patients with the dry form of age-related macular degeneration showed ozone therapy stopped the progression of the disease and improved visual acuity. Significant improvement in pain associated with herniated discs and arthritis. In chronic hepatitis C patients, they had improvement in their symptoms, normalization of liver enzyme levels, and the disappearance of PCR evidence of hepatitis C in 44% of patients. In patients with chronic cystitis, they showed a significant improvement in all parameters when they received ozonated water into the bladder. Here's a study that was done by medical mycology, and it shows the effect on Candida albicans. This is one of those infections that often come along as an opportunistic infection, especially when we take antibiotics. It showed that it completely eradicated Candida albicans on the surfaces of dentures as well as in the blood. And it significantly decreased the biofilm production, although it did not stop it completely. The ozone paradox, this was a study that was done to, I think it was designed to prove that ozone was not safe, and it actually did the opposite. And that they said that there was absolutely no human toxicity found with ozone when used within the correct parameters. Ozone action on the whole blood. This was the International Journal of Biological and Macrobiology, and it demonstrated that judicious ozone doses neither damage the erythrocytes nor induce oxidation on the intracellular hemoglobin, even at doses at twice their upper limit. And this was important because a lot of people thought that ozone would do damage to the red blood cells, and this shows that it doesn't. And then I couldn't summarize this any better, so I just put it all up there, but basically shows that judicious doses of ozone dissolved in the blood cause a cascade of well-defined chemical compounds acting on multiple cellular targets according to well-known molecular, biochemical, and pharmacological pathways. Ozone therapy is proving to be very useful in age-related macular degeneration, ischemic and infectious diseases, and in wound healing disorders where conventional medicine has failed. Critical evaluation of the potential therapeutic utility of this simple, inexpensive medical application by national and international health authorities is warranted and may lead to clinical benefit in a large population of the world. And this is very important because a lot of the world follows what America does. And there's not a whole lot of studies or use of ozone as there should be compared to the rest of the world. Now, just want to show you a little bit of what ozone therapy looks like. This is a picture of our ozone machine, and right next to it is the oxygen tank. Oxygen flows from the tank into this little box, and some little magic happens in there, and 2 oxygen molecules become 3, and ozone comes out on the other end. And this is how we do the therapy. We start a peripheral IV, and then we start pulling the blood out, and there it is collecting. Then we add ozone to it through syringe, and mix it up real good. Turns this very nice bright red or almost pinkish color. And then we give it back to them. Hang it up and give it back to them. And that is ozone therapy. Thank you.